Welcome to this unit on autonomous decision-making. By the end of this unit, you will be able to describe ethical concerns for autonomous decision-making. Implications of replacing human judgment for clinical care. Compared to machines, humans could make decisions that are less fair and more biased. Therefore, there are benefits to replacing human judgment and of humans ceding control over certain aspects of clinical care. The use of AI to inform clinical decision-making may be justified if there is compelling clinical evidence that the system performs the task better than a human. Leaving decisions to humans when machines can perform them more rapidly, accurately, and with greater sensitivity and specificity can mean that some patients suffer avoidable morbidity and mortality. In some cases, automation of routine, mundane functions by AI could liberate a medical provider to build or enhance a relationship with the patient. Other functions could be fully assumed by AI, such as automatic adjustment of a hospital ward temperature. The shift to using AI technologies for more complex areas of clinical care presents several challenges. One is the likely emergence of peer disagreement between two competent experts, an AI machine and a doctor. In such situations, there is perhaps no means of combining the decisions or of reasoning with the algorithm. And there are no clear rules for determining who is right. If a patient is left to trust either a technology or a physician, the decision may depend on factors that have no basis in the expertise of the machine or the doctor. Choosing one of the two leads to an undesirable outcome. If the doctor ignores the machine's recommendations, AI has added little value. If the doctor accepts the machine's decision, it may undermine his or her authority and weaken their accountability. Some may argue that the recommendation of an algorithm should be preferred, as it combines the expertise of multiple experts and many data points, although it has to be underlined that a human doctor implicitly incorporates many more contextual, social, moral, and emotional elements into their decision. It may, however, be ethically challenging for doctors to rely on the judgment of AI, as they have to accept decisions based on black box algorithms. AI should therefore be transparent and explainable. Clinicians will require other types of information about the AI technology, including the data on which it was trained, how and who built the AI model, and the variables underlying the AI model. The ethics of using AI for resource allocation and prioritization. Use of computerized decision support programs to guide resource allocation and prioritization for clinical care has long raised ethical issues. Efforts to base decisions about allocations on an AI technology that relies on an algorithmic formula can produce unintended outcomes. This was the case in allocation of vaccines against COVID-19 at a medical institution in California, USA. Very few of the available vaccine doses were allocated to those medical workers most at risk of contracting the virus, while prioritizing higher-ranked doctors at low risk of COVID-19. There is also a risk that data in AI training datasets may be biased. Bias could lead to allocation of resources that discriminates against people based on, for example, skin color, gender, ethnicity, or socio-economic status. Bias and discrimination in AI algorithms may lead to results which discriminate against certain communities or individuals. For example, to encourage the use of resources for people who will have the greatest net benefit, like younger, healthier individuals, and divert resources and time from costly procedures intended for the elderly. If an AI technology is trained to maximize global health, it may do so by allocating most resources to keep healthy people healthy instead of a disadvantaged population. If AI technologies are designed for efficiency of resource use, it could compromise human dignity and equitable access to treatment. For example, it could mean that decisions about whether to provide expensive treatments or operations are based on predicted lifespan. In some countries in which AI is not used, patients are already triaged to optimize patient flow. These decisions often affect those who are disadvantaged or powerless, such as the elderly, people of color, and those with genetic defects or disabilities. Ethical design could mitigate these risks and ensure that AI technologies are used to assist humans by appropriate resource allocation and prioritization. Furthermore, technologies must be maintained as a means of aiding human decision-making and assuring that humans ultimately make the right critical life and death decisions. Use of AI tools for triage is one of the most compelling reasons for ensuring adequate governance or oversight. The possibilities of unintended bias and flawed inferences emanating from the results of AI technologies used in health settings emphasize the need to protect people and processes from computational misadventure. You have now completed Unit 7 of Module 4, Ethical Challenges. In the next unit, we will look at AI and predictive analysis.